and it will be linked to our website. So that way folks join on demand to watch if they're unable to stay for the entire time this morning. So with that, I'm going to go ahead and get started. My name is Dana Burrell. I am the Deputy Secretary for Military Family Policy and Programs for the Department of Veterans and Military Families. We're really excited to have everyone joining us today for this morning's webinar. This morning, between now and 12:30, you'll be hearing from a number of different organizations, some locally based here in Maryland, others both national as well as internationally serving military and veteran caregivers. You'll be hearing from the Elizabeth Dole Foundation, the Maryland Coalition of Families. The University of Maryland Global Campus is going to provide an overview of their Pillars of Strength Caregiver Scholarship, the VA Caregiver Support Program, Building Better Caregivers, and the Maryland's Office of Overdose Response. For a little bit of background, our department name was changed July 1st of this year to reflect the expansion of our mission to ensure that we are diligently working to enhance our services to dependents, military spouses, caregivers, survivors, and military connected kids and youth. Again, just want to say thank you to everyone who is joining us this morning. I briefly want to highlight a few of our department's core programs. We operate a statewide benefits and services program that is comprised of accredited service officers who are providing assistance to veterans, active duty service members, their dependents and survivors with applying for VA benefits and providing information on how to enroll in VA healthcare. We also operate one state veterans home, Charlotte Hall Veterans Home, which is located in St. Mary's County. We operate a communications outreach and advocacy program that is responsible for ensuring that our veteran community as well as military family community is aware of the myriad of resources and benefits to which they are entitled for their military service. We operate 5 state veteran cemeteries and 5 veteran memorials in the state of Maryland. The picture there on that slide, the top right, is our World War II memorial that is located just outside of Annapolis. We also operate the Maryland Veterans Trust Fund. This is a trust fund that is a set-aside 501c3 organization within our department that provides financial assistance to veterans and family members who are experiencing temporary financial difficulties. In addition, you can visit our website, veterans.maryland.gov, that provides additional information on our 5 core programs, as well as additional information on resources, benefits, and programs that are operated by other state agencies as well. Our Director of Communications, Outreach, and Advocacy is joining us this morning, and she is going to be sharing some resource links in the chat. So please take advantage of those links, save them to your desktop. There's a lot of information that we're going to be sharing over the course of the next 90 minutes together. With that, I would like to introduce our first presenter, Marian Delatorre. She is with the Elizabeth Dole Foundation, and I'm very, very excited to have her joining us. I'm not going to steal the show. I'm going to let her talk about the really exciting announcement that the foundation made here in Maryland earlier this year. With that, I'm going to give the floor to Marian, and I will advance your slides. Just let me know when you need me to do that. So welcome. The floor is yours.
Thank you so much, Dana, and I hope you all can hear me. I apologize if there's some background noise here. I'm also joined today by Liz Rotenberry, who is our Director of Caregiver Support Services and as well as the Maryland Dole Caregiver Fellow. I'll give her an opportunity to introduce herself and And we're so grateful to be here today in celebration of National Family Caregivers Month. Liz, would you like to introduce yourself?
Hi, good morning. Thank you so much for the opportunity to be here. Thank you, Dana, for putting this together. It's always a pleasure to see you and to work with you and with all of our programs and organizations across the state. As Marianne said, I am Liz Rotenberry. I'm the Director of Caregiver Engagement. I help to manage our Fellows program, and we do have, I think, eight of us, including myself, proud Fellows across the state who serve as representatives for the military and veteran caregiver community for the Elizabeth Dole Foundation. They are a strong, powerful group of fellows that love to help support our families. So if there's ever anything we can do to help support not only the caregivers on the call or the organizations involved, if we can come out, speak, share, connect with your services and your community, would love the opportunity to do so. So please do not hesitate to reach out. I am a caregiver to my husband, who served in the Marine Corps for 14 years, and we live in Baltimore in the Towson area. So thank you so much for having all of us here today, and thank you, Marianne, for sharing our great work and the great work you're doing with the state.
Absolutely. Thank you, Liz. And so the Elizabeth Dole Foundation is a preeminent national organization championing military and veteran caregivers through advocacy, research, legislation, and direct support. We've coined caregivers who are spouses, parents, siblings, children, neighbors, and friends caring for wounded, ill, injured service members and veterans as hidden heroes. So you'll see that throughout the slide today. And then children, hidden helpers, who are caring for their parent who's a veteran or service member. So we'll go over to the next slide here, Dana. And so as Dana mentioned, we're very proud of Maryland and their commitment to become a hidden hero state. So last August 6th, Governor Moore signed a proclamation to committing resources to military and veteran caregivers. And so we're extremely excited to have partnered with the Maryland Department of Veterans and Military Families, becoming part of the Maryland Joint Forces. And since then, we've seen family-friendly initiatives from Hidden Heroes Appreciation Nights at the Baltimore Symphony Orchestra to minor league baseball games. So very excited for this. Next slide. And to go through our agenda today, so first off, we've done our introductions here. Second, we'll go into EDF programs and campaigns. Third, innovation and research. So we'll brief you on our latest RAN research that we just launched last September 24th. Lastly, some resources that we've worked on with the Department of Maryland Veterans and Military Families. And then, just if we have some time for questions, we'd love to answer them. Next slide. And so we want to note, who are our military and veteran caregivers and why we really have coined them as hidden heroes. So we know that caregivers are often behind the scenes, critically caring for our wounded, injured, ill service members and veterans. And so we've noticed, just a trend from our caregivers that, because of the care that they're providing, we see that they're overwhelmed, they're facing a long caregiver journey. We've seen some financial strain, and then as well as some challenges that they're going through. And so that's why, we exist as an organization to serve and support them. Next slide. And our organization's history really starts at Walter Reed Medical Center when Senator Elizabeth Dole was caring for her late husband, Senator Bob Dole. And she had walked the hallways and noticed that there were countless family members supporting their service members and veterans. And from then on, she crafted her mission and her vision for this organization. And since then, we commissioned the first RAN report, which was the first ever groundbreaking research on military veteran caregivers, which has informed much of our programming and just our work moving forward. Next slide. And this really leads to our programs and our campaigns that we do to serve caregivers. Next slide. And so we have various resources here. So Liz is going to help me with some of them, noting she's definitely been at the foundation way longer than I have and have seen just the creation and the evolution of these programs. But first off, we know that caregivers experience high financial strains due to the cost of caregiving. And so we have created financial wellness in partnership with USAA to provide webinars around financial literacy, as well as our Hope Fund, which are grants to support families in need of, whether it's thinking about housing payments, natural disaster relief, to even medical bills, dentist bills, etc. And so there is an application to apply through our website there. And then our Dole Fellows, as Liz mentioned, Liz, I'm going to have you take the floor and talk more about this because the application is coming up in December. So feel free to talk more about this one.
Thank you, Marianne. So our Dual Caregiver Fellows program started back in 2012 with our Emeritus Fellows. They were really the essential part of understanding what the impacts that, Senator Elizabeth Dole got to get to know, had the opportunity to get to know these families and had a conversation with them. And so from that, we built our Dual Caregiver Fellows program. And so every year we select a new class of fellows who are military and veteran caregivers. They represent all eras, all relationships, all wounds, injuries, and illnesses. Currently, we have close to 300, and we do pick another 10 to 15 for 2025 and moving forward each year. Our application is opening soon. So if you're a caregiver and interested in being a part of that fellowship and that opportunity to be an advocate and a leader, we welcome all caregivers, whether you're brand new to the caregiver world and kind of going at this, and need the support and the sense of a community and belonging and really could benefit from that, you're welcome to apply. Also, we have several caregivers who come to us who are already starting their own nonprofits or they work for different organizations. So we have a wide range of caregivers that we love to bring on board as new fellows to be our champions on the ground, to provide for us what is happening in their caregiver community. I served as the 2015 Dole Caregiver Fellow for Maryland, and it's been an honor to see how far we've come as a state, and especially with Marianne's great work over the last couple of years, to see how much we are doing. And with our fellows, we're able to help provide those supports to the state. So we do have that application opening. It should be coming out within the next couple of days. So you can look online for that and go to elizabethdolefoundation.org. You can also go to hiddenheroes.org to get to that application. And they are volunteers, they are leaders, but we do offer great networking opportunities, wonderful opportunities to come to DC to spend 2 different weeks with us during that time. The training and the curriculum that we provide is invaluable to really help those caregivers feel a sense of identity and empowering. It gives them an opportunity to really feel heard and supported as well. So if you're interested in learning more, you're welcome to reach out to me directly as well. I'll put my email in the chat.
Thank you, Liz. And then just mental wellness here. So we know mental health is huge for our caregivers, and you'll see that in our next slides around the RAND study. But we offer mental wellness support groups with our mental health consultant on staff. And so they're able to navigate virtual groups with our caregivers and just supporting them through the caregiving journey. And then resource navigation, we do case management on staff. So again, caregivers who are needing resources, we're happy to connect them. Next slide. And then the campaign for inclusive care here. So we know that caregivers, again, are part of the care teams. And so we do our best to really make sure that we educate care providers from the VA to community care. And so this is an opportunity for training the trainer, essentially, where these modules help raise awareness around the importance of caregivers and how to incorporate them better into the care team. And then Hidden Heroes, we're really proud that Maryland has joined the Hidden Heroes Network. And so we have about 250 cities and counties, states that have joined us in their commitment to serving military and veteran caregivers. So they passed that proclamation and they do amazing initiatives like this one. And then our Hidden Heroes Caregiver online community, we have about 3,000 caregivers from all eras. So it's a way to connect with caregivers across the country, find resources, find support, and we do really fun activities there. If I may say so myself, we just had a really cool costume party giveaway there. Hidden helpers, as mentioned, children are part of the household. And so we have a coalition of over 100 military serving organizations that support kids. And we're really coming across ways to increase comprehensive resources for them so that they feel that they can be that regular kid besides their caregiving responsibilities. And then lastly here, Face the Fight, this is our newest program, but we've committed alongside USAA and other organizations to support veteran suicide prevention. So we're very, very much in the works of that. Next slide. And then Liz is very much part of this. So Maryland Dole Fellows, please meet them if you see them in their community. They've been really integral in informing our initiatives and really building, the ways that we do support in Maryland. Next slide. And so innovation and research, as mentioned, we do a lot of research at the Dole Foundation. And for the sake of time, I know we only had 15 minutes here. We're gonna do a little crash course on our new latest RAND study here. So we're gonna go to the next slide. And so there's power in data. And Liz, would you mind, just talking more about that in terms of what does it mean to see yourself in this data?
So it's really important that we hear from our caregivers, that we know what's happening in not only for them personally, but in their community. And through our research that we conducted back in 2014, through our first evidence-based research, we learned so much. But we wanted to take a look 10 years later. Where are we at? What are we doing? What are we missing in the community? How can we continue to assist and provide the supports and resources needed for our caregivers? And so we learned from them. Our foundation back in 2012 and even 2015, when I came on board, we were maybe simply advocating on the Hill, sharing our stories. But now, in looking back at all the programs that Marianne just shared with you, those are programs that were developed and from hearing from caregivers, what is needed, what has been missing. So each one of those has come up from stories being shared and capturing that information and that research. And then the research also helps us to be able to get other organizations to support our caregiver community. So I know you want to, I could sit here and talk all day about this. It's wonderful work. And we hope that you find the information beneficial as well.
Absolutely. So we're going to go through just a couple of slides here about our 4 pillars, and it'll, we'll just point out some data, but Dana, feel free to send out some slides so that people can see more of them. So first off, in 2014, we had actually found that there were 5.5 million military veteran caregivers. 10 years after, there are actually 14.3 million caregivers. And so we've seen an increase over the 10 years. Which is amazing because we're seeing greater self-identification and as well as recognizing that that people are performing caregiving responsibilities in their daily lives, and we've seen that that caregiving is the contribution to caregiving is at least a minimum of $119 billion, and so caregivers are taking on roles in an unpaid way, really saving economy money, but also just again, their major contributions. And we want to recognize that children and teens and caregivers, those age 60 and under, as well are really a huge part of this demographic. Next slide. And so looking at just the profound contributions, we said the minimum was $119 billion. And then we see that the maximum is $485 billion. And again, as you see some of those roles, home health aide, nursing assistant, registered nurse, these are just some responsibilities that caregivers really take up in an unpaid way. And so they choose to either leave the workforce and do this role full time, and then, in a way to maintain that family cohesion as well as the veterans care. Next slide. And so here in Maryland, we have about 150,000 military veteran caregivers. And our RAND data has found that at least 9% of veterans have caregivers. There's also 8% with an unmet need for care. And then these are some of the proxy wages that we're seeing that unpaid caregivers will take up. Next slide. And so, from our second RAND report, we found these 4 pillars. So economic mobility, mental wellness, youth support, inclusion, and care. And we'll go over those in the next slide. Next slide. And so economic mobility, Want to just point out some numbers here that caregivers spend $13,000 on annual out-of-pocket costs, and they often have difficulty paying bills because of those caregiving costs, whether it's medication, transportation, to appointments, and just really the increased need for care. And we see that 35% of military and veteran caregivers are actually below 130% of the federal poverty line, demonstrating financial need. And so that's why we've come up with financial wellness programming for them. Next slide. And so in thinking about mental wellness as well, just some numbers to show you, we've compared our military and veteran caregivers to non-caregivers. And so we see higher levels of mental health issues in terms of perceived stress, depression, suicidal ideation, which is significant. And so we're really doing our best to combat and think about our programming in that way. But just something to note there, as one may see themselves in the data, it's very real. And we want to note that we're doing our best to have resources around it. Next slide. And then as mentioned, kids. Kids are very much part of the caregiving journey. They take up these responsibilities at an early age. And 40% of military and veteran caregivers are also raising a kid and caring for their veteran and maybe even a parent as well. And so we've coined them as sandwich caregivers. And I just want to note, our community has called them double-decker caregivers if they're caring for a parent and then as well as their veteran and their children. So some data there, and we're trying to find other ways to support this generation. Next slide. And then, as mentioned, inclusion in care. Campaign for inclusive care is extremely important, and these are significant numbers. The dark blue state that they have had great experiences, whereas we see the lighter blue, and the majority of caregivers have not been integrated in their care team. And so, again, as a service provider, as a caregiver, it's really important to be part of the veterans health team because they have the greatest proximity to the veteran. And so we really want to emphasize just inclusive care overall from our study here. Next slide. And so, as we do think about the RAND report, you integrate it in your work, you see yourselves in the data. We really want to make sure that we're working collectively with you all and in terms of finding the best solutions and also support for caregivers. And so that brings us to caregiving resources here. So in partnership with the Maryland Department of Veterans and Military Families created this guide for resources. And so it's on the website. There's also a QR code there. And please feel free to make sure to look at it. If you're a caregiver resource, let us know so we can add you there too. Next slide. And so accessing EDS support, we're here for all the caregivers, all eras. So please make sure to visit us, and you can also email Liz and I directly and for more information as well. But again, thank you so much for being part of Maryland Hidden Heroes initiatives, and it's really important as we support our caregivers throughout the state. Next slide. And I want to note here, a well-supported caregiver, the best chance for a wounded warrior to recover and thrive is having a strong, well-supported caregiver. And so this is our why, and we look forward to continuing the why with the state of Maryland. Thank you. And Liz, do you have anything else?
No, just thank you for your time, and I look forward to hearing from all of you today and then connecting with you beyond today's call and let us know if we can do anything to help. Thank you.
Thank you very much, Marianne and Liz, for joining us this morning and for providing that really great overview of the Elizabeth Dole Foundation and also sharing some of the data that's come out of that RAND study. Very, very informative. Thank you. So with that, we are going to move into our next presentation by the Maryland Coalition of Families.
Hello, can everybody hear me and see me okay? I had some technical issues earlier, so let me know if my video is funny or anything, or you can't hear me. So hi, thank you for having me. Maryland Department of Veterans and Families, Military Families, Dana and Lindsay, I appreciate you all so much. And I appreciate the opportunity to present. My name is Christy Green. I'm the Executive Director of Maryland Coalition of Families. And since 1999, we have Maryland Coalition of Families, or MCF, as you will hear me, the acronym you'll hear me say, has been the primary provider of family peer support in the state of Maryland in all 24 jurisdictions. And so happy to share it is our 25th anniversary, and hoping that we can connect today and provide some services and opportunities for all of you out there. Next slide, please. So we have more than 60 family peer support specialists living in all 24 Maryland jurisdictions. A lot of you have heard of peer-to-peer, but you may not have heard of family peer and what that means. So what that means is we support a caregiver of a loved one, any age, that is supporting someone with a behavioral health challenge, whether that's mental health, substance use disorder, or problem gambling. And I'm going to talk about that a little bit more further, but we are a nonprofit. We are free. All services are offered at no cost to families, and we are family run. And what does that mean? We're not all related, but we are all individuals who have experienced this same, this lived experience of supporting and caring for a loved one with a behavioral health challenge. So 100% of our staff have this personal experience, including 51% of our board have this lived experience. So we know what it's like to go through this, to have to navigate systems, to when you feel alone and isolated and frustrated and scared and lost. We know what it's like. So if you come to us for support, you will be matched with someone that also shares and has had that lived experience similar. Next slide, please. So as I mentioned, we support mental health, substance use disorder, and problem gambling. But what I need to say here is we don't define family. So if you are caring for a neighbor, a partner, a spouse, an adult, parent, a child, we support you in supporting anyone that you love of any age that is struggling with mental health, substance use disorder, or problem gambling. Next slide, please. So here are all the different ways that we connect, support, and empower. We provide one-to-one emotional support, which is critical. That's probably the most direct service that we have with our organization. A family peer support specialist will mentor, support, walk you through, go to a home visit, school visit, court visit, wherever you need someone to be by your side to walk you through and stand with you. We have resource connections. We, of course, help with systems navigation. It can be very tricky going through an IEP process or 504, or just trying to figure out how something works with health insurance. We're here to help guide with that. And then we have support groups, and we also have educational trainings and workshops. Next slide, please. So we also provide some other services such as family leadership development, which where you as a caregiver, we help you find your voice, build confidence and skills, learn about all the resources in your region. I like to kind of joke, we're statewide, but we're actually local, we're regional. So everyone in that jurisdiction or in that county or in that region, they actually live there and know how it works in their area. And so we do this regionally. So we promote partnerships with schools and providers, introduce you to them, and develop the natural support networks. And then on a systems level, there's volunteers that we introduce to the organization, organizational ambassadors, advocates in Annapolis, which I'll talk about, and family voice and policy making, all in this family leadership program. Next slide, please. Then we have actual peer-to-peer support, which I mentioned family peer. Well, peer-to-peer is with our young adults. And we want to make sure that our young adults are feeling supported and they have peers working with them as well, and that their voice is heard too. Next slide. And this leads us to our advocacy. And so I'm really excited to announce our Family Day in Annapolis. We'd like to invite you all to participate. We take that direct service, that direct voice of everything we're hearing around the state, and we make sure that it is heard. So we are on over 17 statewide committees, coalitions, and work groups. We hold focus groups to ensure that voice is standing out. We attend our Family Day, which I mentioned. The registration is now live and open. You can get that on our website at mdcoalition.org. And that is an opportunity for you to share your story with your legislator, to be able to advocate for policy change or law changes. And so we usually get around 200 people attend that event. We send in 5 buses from all over the state, and we pick you up and we bring you in for a really exciting day. It's our largest outreach event of the year. And we make those appointments with your legislators in advance, so that when we come in, we have lunch together, we have some keynote speakers, we talk to you about how to strategically share your story, and it's great. It's such a great day. We also, once we get in legislative session, there might be priority legislation that we want to promote, or that you may want to share your story to support or not support. So we will help you with your testimony, whether it's verbal, written, oral, virtual. And then also we're doing a lot where we try to highlight what this is, all of this in the media. Next slide, please. We also have reducing stigma and awareness campaigns. So we are partnered with Mental Health Association of Maryland with the Children's Mental Health Matters campaign. And we at Maryland Coalition of Families do an art contest with kids in schools. All school-age children are invited to get involved, and we pick a statewide winner, and then they're at the behavioral health conference every March, where we announce the winner, and we have posters in both English and Spanish, and we send them out across the entire state of Maryland. We'd love for you to be a Children's Mental Health Matters champion. And then we have kits with resources and the poster competition. So it's really a good way to get our kids involved. Last year, an 11-year-old won. Little girl who drew, it was amazing. She drew a photo of a brain in a garden, and was watering the brain in the garden. And she said how important it was to water our brain every day, just like we would water our flowers every day, to take care of ourselves. And I just thought that was amazing for an 11-year-old to draw that, and she was our big winner. The year before that, Irving, our 16-year-old, was a winner, and he drew a bunch of puzzle pieces with all the emojis and all the feelings, and then his picture, his own self-portrait in the middle, and talked about how important it was to that every day, everything, the way we think, the way we talk, it's all a puzzle, and we're putting together those emotions all the time, every minute of the day. And that was one of our winners as well 2 years ago. So super proud of our kids getting involved and really talking about mental health and promoting wellness, reducing that stigma. Next slide, please. So stay connected with us. We want to support you. We sometimes are called the best kept secret. We don't want to be the best kept secret. We are here for you. We want to support you. So stay connected with us here. Check out our website, email us. On our website, you can request help services with a big yellow button right on our website. We have newsletters, and we're on social media. So I would love to open it up for any questions that you have. And thank you again for this opportunity. And we just really want to shout out your voice and elevate your voice. So we hope to connect with you. Thank you.
Thank you very much, Christina, and thank you for this presentation. I was so grateful to meet you and to receive the presentation at one of our Governor's Commission on Suicide Prevention meetings. And I'm just so thankful that we've made this connection and that you were able to provide this morning's briefing on the really great work that you're doing in support of families here in the state. Lindsay, are there any questions in the chat?
Not yet.
Okay. With that, I'm going to transition to a commercial break and welcome the University of Maryland Global Campus partners to talk about their Caregiver Scholarship.
Thank you, Dana. I am so happy to be here hosting the commercial break. So I'm Kelly Grooms. I'm the Assistant Director of Veterans Initiatives and Outreach here at the University of Maryland Global Campus. And at UMGC, I want to just spread the message that we see you as our nation's hidden heroes. The Pillars of Strength Scholarship Program is here for you. I loved what Christina just said about how this scholarship recognizes you and for anyone that you love. So as we also learned, well, not learned, but it was shared earlier, we recognize the sacrifices that you as a caregiver are making and what you are giving up, specifically in regard to your academic pursuit, your education. So many times caregivers are actively pursuing a program and then life happens and you have to step into that caregiver role and leave behind your academics. So that's where we come in with this scholarship. So this scholarship is going to offer you a full ride scholarship, all tuitions and expenses paid for an entire academic year. This scholarship is specifically for, going back to you caring for a military service member or veteran that you love. This is not limited to just spouses. This is for all caregivers, for service member and veterans. The caveat is that it is for post 9/11 service member and veterans. And that is pretty much the only caveat that we have. So we welcome you to apply. I encourage you to apply. Since its inception in 2013, we have been able to award 84 scholarships. I know that going back to school can be intimidating for a lot of people, especially if you haven't been in the classroom for a really long time. But the good thing is at UMGC, we are here to support you along the way. We specialize in adult learners. We have a flexible learning environment. And also through the Pillars of Strength Scholarship Program, you are going to be assigned a dedicated advisor that's going to work with you from the beginning until the end. We understand the challenges that you have when it comes to just pursuing your education and perhaps needing to take a break because your caregiver responsibilities are taking you from the classroom. And we understand that, and we are here to work with you. So our dedicated advisor approach that we have has been super rewarding and successful for not only our scholars, but also our staff members. So we also, due to the generous funding that we have had for this scholarship, it is very rare that we have had to turn an applicant away. What the application looks like, it's on our website. So I have it linked there. There are essay questions. There are 5 essay questions for you to meet. And then there's just some documentation to demonstrate the post 9/11 status. And once I get your application, it comes right to me. I will call you. I will help you along the entire process of ensuring that we've got everything good to go. And then when our application period ends on April 30th, I'll package all of them up, put a bow on them, send them to our review committee, and then I will be in touch with you every step of the way to hopefully deliver that good news that you will be continuing or starting an education, doing something for yourselves, to giving back to not only your family, but also really to the community. So that is the Pillars of Strength Scholarship in 5 minutes. And I did see that we had a question. And I can't see it again.
Oh, the question says, is the scholarship limited to degree seekers or can it apply to certificate programs?
Thank you so much for that question. That is a great question. It can apply for degree seekers as well as certificate programs. So again, we'll take from undergraduate level to graduate level, degree seeking, or non-degree seeking on any academic level.
Are there any other questions in the chat, Lindsay?
Nope, I just shared that I love UMGC. I'm currently enrolled in classes right now and couldn't be more pleased with it.
Thank you, Lindsay. I appreciate that.
And now we'll return to our regularly scheduled programming and move on to our next presentation that is going to be provided by Miss Jackie Adams with the VA Caregiver Support Program. So Jackie, you have the floor.
Thank you. Welcome, everyone. I'm thrilled to be here. Thank you, Dana and team, for inviting us and organizing this event. And happy National Family Caregivers Month to all our amazing caregivers out there. I'm Jackie Adams. I'm the Caregiver Support Program Manager at the VA Maryland Healthcare System. First, just want to let you know, if you don't already know, the VA loves acronyms. So I will refer to our health facility as VAMX. And then we have acronyms for our services as well. So next slide. So the Caregiver Support Program is an umbrella term. And under that umbrella, we have two specific caregiver support programs. Both of them adhere to the 4 pillars related to our mission, which is to promote the health and well-being of family caregivers who care for our nation's veterans through education and support, collaboration and partnerships, outreach and resources and referrals. All right, so that's the foundation of our program. We have the 2 here listed, and you'll see acronyms. So I'll start with PGCSS, Program of General Caregiver Support Services. This is for any family member who is caring for any enrolled veteran. When I say enrolled veteran, I mean any veteran that's enrolled in care at a VA facility. This program is a national program through the VA. The veteran has to demonstrate or have a need for a caregiver, but basically this is an easy to enroll program which would give the caregiver access to services. I'll talk a little more about that in a minute. And then we have the Program of Comprehensive Assistance for Family Caregivers. That's a big mouthful too, PCAFC. Sometimes you hear that referred to as the comprehensive program or the stipend program. This is a more enhanced program for caregivers. But because of that enhancement, there comes a lot more criterion and application process. So we'll get to that. Next slide. Okay, so this is really important. And if you look down at the bottom of that slide, there's a website, www.caregiver.va.gov. That is a very comprehensive website. It has a ton of information on both of our programs and the services and how to reach people. So please keep that handy. If you're not already enrolled in one of our programs and you're interested, that is a great website to start with. And we also have the VA Caregiver Support Line. That's a national line. Caregivers of veterans can call that. And that number's down there, 1-855-260-3274. Okay, so that's my commercial. Okay, so what is it that we do for our caregivers? For both programs, the foundation services are available. And I'll get into that a little more, but this chart shows you that they share plenty of services, right? The comprehensive program then has additional services. So there is a stipend for the primary caregiver. And in the last couple of years, we've been able to add legal and financial planning services, which is new and wonderful. And for the caregivers who do not have access to health insurance, we can enroll them in a CHAMP VA health insurance plan. We also have, which this has been relatively new as well, virtual mental health psychotherapy for our caregivers in the PCAFC program. We also receive additional respite funding than the rest of VA has. So we have an enhanced respite services program for our caregivers in PCAFC. They also get access to the base if they want to go to the PX. And then we're working on Benny Travel as well. But most of our veterans are already enrolled in that. So as you can see, these are significantly enhanced services in PCAFC. So next slide, please. All right, so these are the support services for everyone in either program who has wants to try them out. We have coaching options, we have skill-based options. They are evidence-based programs. So we can start off with the SAFE program. This is actually a national program and it's free through the web through PsychArmor. What this program does is it helps caregivers identify when a veteran might be having suicidal ideation, and it works towards suicide prevention. So SAVE stands for Signs, Ask, Validate, Encourage, and Expedite. And we've added a component to it at VA that also supports the caregiver who might be having a crisis as well. So this is an offering we do usually twice a year. If the demand is more, we'll do it more. It is run by our staff. And this has been promoted for quite a few years now. And we always encourage our caregivers to attend that. Building better caregivers, I'm not going to really get into that because we have a presentation after me, but VA is part of that as well and supports building better caregivers. One of our, I would say, favorite and popular options is the Annie texting program. We get so much positive feedback. So Annie is a platform that will magically text you messages, support messages, jokes, sayings, just at the right time. That's what the caregivers tell us. They're just amazed that Annie just knows what to say and when to say it. There are different types of text groups that can be done, and when you sign up, you just let us know. So that like takes no work on the caregiver. It's nice, right? They receive it. And then our coaching, we have Reach VA and Caregiver Health and Wellbeing. So Reach VA stands for Resources for Enhancing All Caregivers' Health. We do that through individual and group sessions, work on stress management, problem solving, self-care, healthy behaviors, how to handle veteran behaviors, and we have staff trained to provide that. Caregiver health and well-being coaching at BAMX, we have 2 certified coaches on our team. What I would say about this is relatively new offering in the last couple of years. This is an offering that focuses solely on the caregiver. Doesn't matter what the veteran's diagnosis or issues are. This is strictly for the caregiver to identify their goals, what they want, and work out a plan. We use the personal health inventory tool and we work out a plan and we coach the caregivers. So this is a different type of coaching than what most of our other programs offer. And then we have Caregivers First, which is a very skill-based process. It's a group and we do 4 sessions. In addition to those, so those offerings are nationwide, right? Each VA offers those. And then the VAs have the opportunity to offer local offerings. And at VA Maryland Healthcare System, we have multiple offerings. We have a very long-term psychoeducational evening group for caregivers. For a while, we had a group for caregivers with minor children because that was a need that was voiced. Art groups, aromatherapy group. We started doing CPR friends and family to teach caregivers CPR skills. So we really try to reach out to caregivers, see what the needs are, and if it doesn't exist in the community, then we try to make sure we can create it within VA and provide what our caregivers ask for. And this month, of course, in November, National Family Caregiver Month, we have celebrations for our caregivers. We've had 2 resource fairs this month. We'll have more. And there's just a whole slew of opportunities for caregivers in our program. Okay, next slide. Next slide. Okay, this is the general program, right? PGCSS. Easy. All you need, if you want to enroll, you just call us, or you can call the caregiver support line and they'll get to us and let us know, and we'll reach out. The caveat is that your veteran has to agree. And if you enroll in PGCSS, the caregiver would have a chart, just like your veteran. So we'd need your social security and date of birth. And that chart is used to document the opportunities you take advantage of. The veteran has to be enrolled in RBA, does not have to be receiving care though, as long as the veteran's enrolled. So that would give you access to all those support services. Okay, next slide. Next slide, I'm going to spend a little more time on this. The comprehensive program, PCAFC. This is a more in-depth application process because there is a stipend and additional services involved. And everything we have is based on regulations from our government. So veterans must be at least 70% service connected. If they're not, they will not meet eligibility right up front. They have to live in a state. I get calls from veterans who are expats in other countries. They have to be living in a state or U.S. territory. And the caregiver has to be at least 18 years old. And this is oriented towards family members, but we understand that their family means different things to different people. And so if somebody is not, if the veteran doesn't consider them a family member, they have to then be living or be willing to live with the veteran. So there's a fairly high threshold of eligibility for this program now. And this slide actually goes into it. So a veteran, it's based on the veteran's need for a caregiver. That's what the eligibility, the primary eligibility is based on. And the veteran has to demonstrate a need for hands-on caregiver assistance in at least one activity of daily living each and every time. And also have a need for supervision or protection, or a need for extensive instruction. So if you go on our website, it's explained. There are a lot of fact sheets on there. We also look at, is it in the veteran's best interest to be in the program? We also work with the family to let them know if participation would impact other services like in-home aid services through VA. And also the veteran has to be willing to receive care at VA. That doesn't mean the veteran gives up any care that he or she may have in the community. They would just need to be enrolled and go to primary care once a year. So keep that in mind. Okay, so next slide. How does one apply? Well, the website, like I said, it's amazing. There is a link on the website, www.caregiver.va.gov. you actually can fill out the application on the web, hit the submit button, and we magically receive it in our portal. So that's the easiest way, but you can also print the application from the website and mail it to us. So there are multiple ways. So the application, if by chance somebody gives you an application for us, it's called a 1010CG. Please make sure the revision date on it is May 2024. Otherwise, we have to send back a new application for you to complete. We have a very strict timeline. 90 days sounds like a lot of time, but it truly is not a lot of time in this application process. This is an application process very different than most Veterans Health Administration services. So in order to get everything done within 90 days, my recommendation would be, if you are interested in applying with your veteran, to please obtain your medical documentation for the veteran that demonstrates or supports the need for a caregiver within the last 2 years. Any documentation in the last 2 years. Start getting that before you apply. We have experienced folks who were unable to complete everything in 90 days because of a delay in getting community medical records. So I would really recommend that if you're interested in applying, that you start working on any community records that you need now before you apply. Okay. Next slide. And there's a lot of boxes here, right? Like, it's an intense application process. So basically what happens is you submit your application. We do an intake with the veteran. If the veteran is unable, we do it with the caregiver or the designated power of attorney. And as soon as we start conversating, we also inform about our general program, PGCSS, because caregivers can enroll in that, take advantage of all those support services while they're going through the application process for PCAFC, right? We want to support caregivers, and we can support them through this process as well. And then we have a veteran assessment, a caregiver assessment. Then I have clinical assessors who are occupational therapists. They do functional assessment. And then that all gets wrapped up neat, and that goes to our regional office called a VISN, and they have an interdisciplinary team. That team reviews it. And what happens at that point, they make a decision. Either they're denied, or they're tentatively approved to move on to the next steps. The next steps would be caregiver training, which is done online or by hard copy. We can have the book sent out. Caregiver has to pass a test. Then our clinical assessor comes out to the home to make sure that the veteran's needs and the caregiver's abilities can be done in that environment. And then that all goes back to our review team, and they do a final review. And they let us know either they've been approved or denied. If they're approved, then they'll let us know about level 1 or level 2. And this all has to be done in 90 days. Next slide. Thank you. So the approval would be based on a 2-tier system. So we have level 1 and level 2. And that determines how much the stipend is. So our stipend right now is based on the GS wage scale at grade 4, step 1. Locality pay is included in that. And so if somebody is a level 2, that means they're at the highest need in our program. And so the caregiver would get 100% of grade 4, step 1 with locale pay. If it is a veteran who is level 1, then they would get 62.5% of that monthly stipend. So the difference is, based on all this, the review team determines that if the veteran is unable to sustain in the community, if that's very clear, that's level 2. If they are not determined to be unable to self-sustain in the community, that's level 1. So we sometimes have families where the veterans, we start off with level 1, the veteran's health deteriorates, we reassess, and they end up level 2. And we've had situations where the first review period, they give them a level 1, and then by the time they get to the final review, it's a level 2. So it all depends on the needs of the veteran. Now, what we need to be really clear about, the stipends are paid to the caregiver, not the veteran. They are paid by direct deposit to the caregiver. Okay, next slide. And what are your rights if you're denied when you apply? We have multiple appeal options. They're pretty in-depth. I would say check the website, but basically we have 2 clinical appeal options, level 1 and level 2. And a few years ago, they added 3 additional appeal options. The supplemental claim, higher level review, and they also added the board, the Veterans Appeal. So that's great. That's an option as well. So we have 5 appeal options for families. Next slide. Okay, so at VAMIX, we cover a lot of Maryland, but not all of Maryland. So if you're attending health, if your veteran's primary care is at one of our community outpatient clinics or at Lock Raven, Perry Point, or Baltimore, then your application would come to us. If you're, for example, out in Western Maryland, Fort Detrick and West, that would go to Martinsburg. If you're going to a community outpatient clinic in, say, Montgomery County, PG County, Charlotte Hall, that would go to DC. But the programs are basically the same. We are required to offer all those services. So if you are interested and you have questions for us, you can call our main number at 410-605-7000, 54143, and we can answer your questions. Okay. I'm going to end here because I could talk a lot longer. So are there any questions folks may have?
Lindsay, are there questions in the chat?
There are. There is a question on if you are able to help with hospice when there is also an aging parent, and does the caregiver support program have income limits?
Okay. We do not have income limits. And we actually have families that apply to get the additional respite. The stipend isn't as important to them as the respite is. So income limits, not a problem. We do work with veterans who are receiving hospice services. I guess I'm a little confused what the question means. What the intent of the question. Okay, how can hospice when there's an aging spouse? Okay, so we work with the caregiver that's already in place, right? So if we have a veteran who is needs more in-home aid care, because we often have older folks, married couples, and the spouse is able to provide the supervision and instruction and some limited hands-on care, but there may be a need for additional care. The VA does have a home health aid program that we can connect folks to. It would depend how many hours they would be eligible for based on their participation in the comprehensive program in PCAFC, because we don't want to duplicate services. But we certainly do have quite a few families in PCAFC who are getting home health aides. And if folks are receiving home hospice services and through a contracted hospice agency that the VA provides, whatever they receive through them is not counted towards PCAFC. So I hope I answered that. Okay, any other questions?
I see Nicole has her hand raised. We've got time for one more question.
Okay.
Thank you so much, Dana. So quick question. If someone is a veteran, they are 100% disabled vet, but they receive their care, say, through either a military treatment facility or a civilian provider, do
Mhm.
they qualify for the caregiver program? And, and if they were to need some measure of care in home?
Yeah. So you mean for if they have a family caregiver already in place?
No, even if they were needing a caregiver, well, I guess both. So if they already had one in place or if they were in need of a caregiver, let's say they were to have surgery that prevented them from being able to care for themselves for an extended period of time, is there something through the VA that could be utilized, or would they have to enroll in the VA for care?
Yeah, they would have to enroll in order to access any VA services. A veteran would have to enroll in care. And most of the services through VA are accessed through the primary care provider. So there's a primary care team called PACT, and there's a social worker on that team. So we often get veterans who are older that never had any involvement with the VA. And so they enroll. We hook them up with their primary care team. And if they need in-home aid services, we call it a home health aid program. We work with our geriatric program to get those in place. And then we would work with them on the caregiver support side if there's a family caregiver in need. But they do have to enroll. And the first step is to enroll, and the second step is to get a primary care appointment.
Thank you.
Mm-hmm.
Thanks, Jackie. So we are going to move on to our next presenter, Dr. Cynthia Macri, who's going to talk with us about building better caregivers. Dr. Macri, are you with us?
But I was muted. So I'm going to switch gears a lot and talk about the Building Better Caregivers program. It's a specific program that's available to the public that includes veterans, family members, caregivers, etc. And but first I want to give a huge, gigantic shout out to Dana, because we've been working together for how long, Dana? Maybe 3 or 4 years. But I just asked her a simple question, and this incredible webinar full of information just magically appeared. So thank you so much for that, Dana. And I wanted to talk a little bit. I had attended the Hidden Heroes event in Maryland, in Annapolis, and I just asked a simple question. Well, what about the caregiver? So I just wanted to talk a little bit about a specific program that's available to improve the lives and the support for the caregiver themselves. So one of the things that I've noticed, well, I am a retired naval officer. I was a military physician for 35 years. And one of the things that I noticed is that, hey, I've been telling everybody do this and do that to improve your health. And yet, the world is still unhealthy. So, so what is it about our approach in medicine that doesn't fit or doesn't inspire people? And I also observed that diversity in the military is increasing. And therefore, family members also are increasing. And one of the things that I observed too is that both the veteran or the caregiver, who could be not just a spouse, not only in the category of spouse or child, could actually be a parent. And language specific and linguistic and cultural specific programs may be difficult for the caregivers to access. So in my retirement, I switched gears from being a cancer surgeon to looking at what what can we do in prevention, or what can we do in the public health sector. And what I found is I got connected, and I think the next slide will be helpful. Okay, so I got connected with Maintaining Active Citizens, which is one of the 5 oldest area agencies on aging in the United States. And it was headquartered in Wicomico County in Salisbury, Maryland. I was attending a event, just a health resource fair, and I ran into some folks from Maintaining Active Citizens, and I got involved with these programs that were developed at Stanford University's self-management program. So where I'm getting to is that we've heard a lot about what organizations we can provide to veterans and to the caregivers and family members, and actually to the general public. But what struck me about the Stanford-based self-management programs is that we looked at what's in the participants' toolbox. So in the caregiver's situation, right? What are their tools? Not what are my tools that I can give to you and have you, try to pound a square peg into a round hole. But what are your tools? And can I model that, or can we together figure out how useful your tools are, and how can they be leveraged to improve your life and the caregiver's life, and therefore be more supportive or more present when they're providing care to their loved ones, which may be a scary thing, right? So sometimes well, certainly in my specialty, sometimes the requirements for the caregiver seem like it was more than what they signed up for, basically. But maybe through the use of their, what's in their own toolbox, they may be able to navigate those difficulties with more grace. So next slide, please. MAC is the license holder for the Self-Managed Resource Center, all evidence-based programs. And they, and with their statewide partners, of which I am involved with at least 3 nonprofits, health resource nonprofits in the state of Maryland, in Montgomery County and Frederick County. And we deliver these programs, and we train people to deliver the program, so that it becomes a very comprehensive peer-led program. So I saw on the attendees list that Kate Liu from the Chinese Community and Cultural Center, and Leanne Eagle, who's the CEO of the Living Well Center of Excellence, are on the call as well. So shout out to them. We've been partnered with them for several years, delivering these evidence-based programs. So these aren't just stuff that I made up, right? They're evidence-based programs that help seniors and their caregivers and family members to navigate aging at home originally, right? And now we can apply them, and we've delivered these programs to veterans, both at the, from the community, and there's no issue with accessing the programs, just letting us know or signing up when the programs become available in the community. So they don't have to sign up for anything other than the actual program. So Dana, could you switch to the next slide? So this is the Building Better Caregiver program from the Maryland Living Well Center of Excellence. It is a 6-week online course. How does it differ from what the VA offers? Well, you don't have to go, you don't have to be enrolled in the VA in order to access Building Better Caregivers. the online program with the VA, I talked to the people in at the Self-Managed Resource Center, and the program at the VA is asynchronous, but the one that we do in the community is, where is more geared towards beginning and ending with the same cohort of people, and it is designed to for caregivers to help with their own mental health. So we're not going to teach you how to be, lift people or, give medications or anything like that. How we participate is that we try to help the participants who are caregivers to better to improve their own mental health and physical health in order to be better caregivers or be present for their loved ones. Next slide, please. So this is just a description of the program, and the Living Well Center of Excellence does have a unique service that tablets are available to loan for those people who don't have access to iPads or computers. And during COVID, if we learn nothing else, right, there was and there still is a group of people who are geographically or socially isolated as well. So this is an opportunity to stay connected with each other. So next slide, please. And then this may be one of the last two slides, but so Living Well Center of Excellence also offers other free workshops for the community. And in my experience, I have peer-led veteran groups for chronic disease self-management, diabetes self-management, and also chronic pain self-management. As everybody knows, mental health is not separate from physical health. And in fact, if we can, take tiny bites out of the apple, we may be able to overall improve the way that we care for others. So these are some of the other free workshops that are offered by the Living Well Center of Excellence and may be available in the community. I do know for sure that the Chinese Community and Cultural Center offers Living Well's Building Better Caregiver program, diabetes self-management, chronic disease self-management, and chronic pain self-management. Most of the programs are provided in English, but there are some programs available through CCACC that are language specific as well. So next slide. And so, this is just a description of the program. The bottom line is bullet number 3, right? It enables family caregivers to be better caregivers by modeling behaviors and tools that include living a fulfilling and active life as a caregiver. So don't the person from UMGC mentioned, sometimes you put your academics on hold, you put, your social life on hold. And this is maybe a way to help you as a caregiver complete or return to an active life as a caregiver. Next slide. And for more information, I want to just give you the website. It's MAC and Living Well offer a wide range of services, interactive workshops. These are highly participatory and also evidence-based. They may benefit both the caregivers and family members. And like I said, we did look at things like cultural and linguistic, access for both community as well as community members as well as military and family members. And that's your website. If there's any questions, I'll be happy to answer.
On my Cynthia, on my this is Leanne. I just want everybody to know that these classes are offered also on a hub, so anybody within the state can take these workshops. We are getting ready to offer advanced advanced, I'm a savvy, building better caregivers. All that is actually offered on the hub. And the cost of those classes is free right now. So anybody that could go to that website and sign up and take it within their comfort of their home.
Thank you very much, Leanne, for that. And thank you, Dr. Macri, for telling us a little bit more about building better caregivers. With that, we are going to transition now, and I'm going to invite Emily to the floor to talk with us a little bit about the Maryland Office of Overdose Response and saving lives with naloxone. Emily?
Thank you so much. Good afternoon, everyone. My name is Emily Keller. I'm the Special Secretary of Overdose Response for the Moore Miller Administration. Thank you so much to the Department of Veterans and Military Families for inviting our office to be a part of this event and for all that you do to support current and former uniformed service members in Maryland. Thank you as well to all the caregivers on today's webinar. Your selflessness and devotion in service to others exemplifies this administration's goal of creating a Maryland that leaves no one behind. We are so much better as a society for what you do. And to any veterans or active duty personnel, thank you for your service. As we get close to wrapping up today's webinar, I want to briefly talk about our office and Maryland's overdose response priorities. I'll also talk about how our mission intersects with the work of everyone here and what we can all do to help reduce overdoses in Maryland. Next slide, please. At Maryland's Office of Overdose Response, we work to increase collaboration between state and local partners working to address the overdose crisis. Substance use disorder affects nearly every aspect of someone's life, and every agency that provides services to people has a role to play in making connections to care and supporting people in substance use recovery. We work with all the state agencies and Maryland's Overdose Response Advisory Council, which is chaired by Lieutenant Governor Aruna Miller and provides guidance to the state's overdose response strategy. We also engage with partners across all of Maryland's 24 local jurisdictions to share best practices and to identify areas of collaboration. Our team maintains and updates Maryland's Strategic Overdose Response Plan. We distribute grant funding every year to support high priority initiatives, and we oversee the use of prescription opioid settlement funds at the state level. Lastly, we conduct public outreach on behalf of the governor. Next slide, please. Our office focuses on 5 overarching areas to help guide the state's overdose crisis response efforts: prevention, harm reduction, treatment, recovery, and public safety. These pillars help ensure that we address the needs of individuals with substance use disorders from all angles. Prevention strategies seek to deter current and future substance use, such as young education programs. Harm reduction focuses on meeting people where they are at without judgment. Harm reduction gives people tools like the overdose reversal medication naloxone or sterile equipment that prevent overdoses, reduce the spread of infectious diseases, and improve physical, mental, and social well-being. This also improves our chances of making connections to care by fostering and maintaining relationships with people who use drugs. Next up, we have treatment. We recognize there is no one-size-fits-all approach to substance use treatment. Treatment services work best when tailored to individual needs. Comprehensive recovery services help support the health and wellness of individuals following periods of active substance use or treatment. Recovery efforts can help reduce the risk of relapse and overdose by addressing a person's fundamental needs, such as housing, support, transportation, and meaningful employment opportunities. Lastly, public safety officials play an indispensable role in overdose response efforts. For example, they can help create pathways to care that avoid criminal justice involvement, such as through law enforcement assisted diversion or LEAD. Public safety officials can also help expand access to care for individuals who are already involved in the criminal justice system, for example, by offering substance use treatment and recovery services in detention facilities. Next slide. Switching gears, I just want to quickly talk about the current state of the overdose crisis in Maryland. Fortunately, we've seen overdose rates begin to decrease in the last couple of years, following historic highs here and across the country during the pandemic. There were 2,511 fatal overdoses in Maryland in 2023, an annual decrease of 2.5% from 2022. For comparison, there were 2,800 fatal overdoses in 2021, the most in our state's history. This is real and substantial progress. However, nearly 7 people a day continue to lose their lives to preventable overdoses, and we can't afford to let up in our efforts to reduce overdoses and save lives. Additionally, although fatal overdoses are decreasing, we are continuing to see widening racial disparities and increasing rates of fatal overdoses among people over the age of 55. For example, between 2017 and 2023, fatal overdoses increased by 65% among Black people in Maryland, while decreasing 25% among white people in Maryland. During this time, fatal overdoses among people over the age of 55 increased faster than any other age group. This is just a high-level look at these trends, and if you want to see more detailed information, you can visit the Overdose Data Dashboard, which is linked on our website of stopoverdose.maryland.gov. Next slide, please. I also wanted to briefly share some data regarding overdose trends among current and former service members for those of you who might have individuals with substance use disorder in your lives. Because the better we understand what the risk looks like, the better we're able to respond. This info comes from the Maryland State Unintentional Drug Overdose Reporting System. Compared to the general public, current and former service members were more likely to be over the age of 45, more likely to be Black, more likely to be married, more likely to be divorced or separated, more likely to have higher education attainment, and more likely to experience a fatal overdose at home. That last point is really important. For example, data tells us a majority of overdoses, about 65%, happen in residences among the general population. And in most instances, bystanders, such as family members or a roommate, were nearby but did not administer naloxone. This risk is even higher among current and former service members. Not only is it important that everyone who uses drugs have naloxone with them, anyone who has someone in their lives who uses drugs or may should learn how to recognize and respond to an overdose. If you use at home, keeping the door unlocked with naloxone out and visible to anyone who enters the room could be life-saving. Next slide. So how do you respond to an overdose? It starts by knowing the symptoms, which include loud snoring, pale skin, a limp body, slow or stop breathing, unresponsiveness, blue lips, or fingertips. If you suspect someone is experiencing an overdose, please always call 911. Then you should try to get their attention. One way to do this is by rubbing your knuckles along their sternum on their chest as hard as you can. If you have it, administer 1 dose of naloxone every 2 minutes until the individual is breathing on their own. You then roll them on their side into the recovery position to prevent choking. If you don't have naloxone, it's very easy to find. Maryland has a network of over 240 overdose response programs, which provide naloxone free of charge and without a prescription. You can visit our website to help you locate where you can find an overdose response program near you. Next slide, please. I just wanted to show you what naloxone looks like. It's a very simple kit. If you administer it, you just peel open the back, and it's really not scary. It is just like a nasal spray. So if you see here, if you've ever used something like Afrin before, that's exactly what it is. You would insert it into someone's nostril, push the button until it clicks, and that administers the drug into the person. So it's very easy to use. It just goes right in the nostril. And we ask that you first call 911, administer naloxone, and then roll the person on their side. Next slide, please. So with that, I just want to thank everyone here today. Thank you for all you do to support your fellow Marylanders. We greatly value your partnership. We know this work is a team sport, and we need everyone involved from the highest levels of government to community members across the state. So please feel free to reach out to us at any time. And always remember, if you or someone you know is struggling with substance use or mental health issues, you can call or text 988 to get connected to someone who can help. Thank you, Dana.
Thank you very much, Emily. And we have started incorporating this training and briefing into most of our briefings, specifically centered around suicide prevention. If you are interested in having this office provide a presentation at your events or need connections to your local health department in order to do so, please let us know. I have naloxone in my home, just in case. I think it is so important for us all to have a better understanding of how to administer this, because like Emily said, together we can save lives. With that, we have come to the end of this morning's webinar in honor of National Family Caregivers Awareness Month. This recording will be on our DVMF YouTube channel. If not later today, then it will post sometime this weekend. We encourage you to sign up for our department newsletter by visiting the homepage of our website. Please follow us on Facebook as well as Instagram. We're also on LinkedIn and Twitter, X, formerly known as Twitter. Again, thank you so much for all that you do. When our military and veteran families and caregivers are thriving, our veterans and active duty service members are thriving here in our state. So thank you so much. Have a wonderful holiday season and take care, everyone. And thank you for being here today. That concludes today's webinar. Thank you.